welcome to week 11. It is finals week. We have finally made it here. This week, your final chapter is going to be discussing chapter 47, which talks about phlebotomy. Now, this is a really nice chapter to end Clinical Skills 1 with because it is a nice lead in to what lab skills will be all of next quarter. So let's go ahead and get started. So the first important thing that you really need to understand talking about this chapter is what exactly is phlebotomy. You need to have a pretty good understanding of what that means. So phlebotomy or venipuncture, those words get used interchangeably, refer to collecting blood through a tiny incision in a vein, generally through a hollow needle. Okay? It's important for us to draw blood because what happens is then we can analyze that blood and look for any abnormalities for the patient, which then will aid the provider in prolonging their life or even maybe saving their life. So drawing blood is a really important job of a medical assistant. And when it comes to actual phlebotomy, your role as the medical assistant is really going to be to collect that blood, to label it properly, and then either process it or store it to be processed. Okay? It's also something that you need to be aware of. Just because you learn how to do phlebotomy here in your schooling does not mean that every facility you work at will allow you to actually draw blood. So please be aware of the standards of where you're going to be working, because that will play a big role in whether or not you can actually draw blood. I know some facilities actually want you to be a certified phlebotomist before they'll let you draw. Another thing that's really important for medical assistants is having a basic knowledge of your circulatory system. Reason is that's where a lot of your blood flow comes from. Now, I'm not really going to talk about it on this video, but I do want you to read your chapter this week so we can have some open discussion, and I might ask you some questions about your circulatory system. Alright, so we understand what phlebotomy is, but let's talk about where it gets performed. So phlebotomy is generally drawn on one of the three main veins, okay? And these main veins are going to be found in your antecubital space, which is actually the bend in your elbow right here. So if you were to bend your elbow, it's this space here. And those three main veins, the first one is the median cubital, second is your cephalic, and third is your basilic. Now, median cubital is going to be the most commonly used. It is the biggest vein, and it's actually the most anchored. And the median cubital can be found pretty similar to what it sounds like, just right down the middle of your antecubital space. Okay. Cephalic, on the other hand, is your second most common used, and it's anchored well, but not as well as your median cubital. And that is actually located on the thumb side, so it's over here. So if you were to draw a line up from your thumb all the way up to your antecubital space, it should be on this side of your arm. And the last one is the basilic. Now this vein is not used as often. It's generally a little bit smaller. It's not anchored very well, and it's actually found right above your basilic artery. So you want to be careful to use that one because you could end up going through the vein and nicking the artery. So we want to try to avoid doing that. That is located on your pinky side. So if you drew a line up from your pinky, it should be on this side of your arm. Alright, so those are the three main veins that we want to use. But there are some areas on the arm or the body where you're going to be drawing blood that you want to try to avoid. So you want to try to avoid places that have a hematoma or a bruise. Reason being there's dead blood cells underneath that skin and you don't want to contaminate your sample. You want to avoid any areas that have scars or edema or swelling. Reason being you have excess tissue fluid or excess tissue, which makes it a little bit harder and tougher to go through. You want to avoid areas that have a fistula or a vascular graft. And you also want to avoid drawing from the side of a body where a mastectomy happened. Just reason being your lymph nodes are not as prepared for that, or there may not be any lymph nodes. Alright, so we know what phlebotomy is and where we draw it. Let's talk about how we draw it. So there are 3 ways to really perform a phlebotomy. First one is the evacuated tube method. Second is the syringe method. And third is the butterfly method. Okay. I'm not really going to discuss these at length, just due to the simple fact that all of next quarter I spend weeks and weeks and weeks talking about these. We spend weeks and weeks and weeks practicing them. So I'm going to leave that up to you guys to read about, and if you have any questions you can bring them to me, but we're not going to go too in-depth with them this week. Alright, so the last thing I want to talk about is the equipment that we're going to use during a phlebotomy procedure. The first and most important equipment that you'll use is a tourniquet. A tourniquet is a large, flexible strip. It's either going to be latex or it comes in rubber if patients have a latex allergy. It gets applied to the skin about 3 to 4 inches above where you're going to be drawing blood. So if you're going to be drawing blood here, your tourniquet goes up about here. Okay? Kind of where the middle of your blood pressure cuff would be. Tourniquets can only be left on the arm for 1 minute at a time. After that, what happens is you get a breakdown of the blood vessels, and it actually starts to cause a hemolyzed sample. Now, tourniquets should be applied tight enough that they restrict your venous blood flow while still allowing arterial blood flow. The reason being, you don't want to cut off arteries. That's how people lose appendages. So I will teach you the ways of the world of tourniquet tying so you do not go too tightly. Okay? Second piece of equipment is going to be your blood collection tubes. And really, those are going to come in different sizes, in different shapes, in different colors. They're going to come in plastic or glass. They're going to have different additives, or they're going to have a gel in them. There's a whole rainbow world of colors that can happen for blood collection tubes. And I'm actually going to pull out a bunch this week so you guys can kind of play with them and get a good idea of what they look like. They're really designed with a little vacuum inside of them that will automatically fill to the amount of blood that they need. Okay, so you don't have to worry about knowing how much 4 milliliters is, how much 10 milliliters is. It will do all that work for you, so you don't have to do that. Now, it also talks in your book about the correct order of draw. I'm not going to talk about that on this video, because again, next quarter I get all sorts of fun to talk about that, so bear with me, we will talk about that in a few weeks. Alright, and then the last piece of equipment that you're really going to need is the tube holders and the needles. Now, tube holders are really the plastic device that goes between the needle and the tube. Okay, helps connect them together. One side of that will be ribbed, so that way you can twist in a double-sided needle. And it's very useful for taking tubes on and off during the evacuated tube system or the butterfly. We do not use a tube holder with the syringe method. Now, needles, on the other hand, are going to come in different shapes and sizes. You guys have already kind of gotten to see some of the different sizes of them working with doing injections. But generally for venipuncture, we're going to use a 20 to 21 gauge needle. And they're generally about 1 inch to 1.5 inches long. They can be double-sided or single, like you've seen with your injection quarter. Alright, so again, I didn't want to go in too much depth with this, just because we're going to spend a lot of time next quarter really learning about the phlebotomy procedure itself. So I'm not going to spend a lot of time this week talking about it. I will get your feet wet and let you play with some of the equipment, though. For this week, you still do have one discussion post. That will focus on just phlebotomy errors. Okay, the most common error is going to be misidentifying a patient or mislabeling a sample because of a misidentification. What your discussion post is asking you for is to look at an error outside of that. It can be an error that happens during the procedure, before the procedure, or after the procedure. Okay? So look at those and explain how that error might happen. I would really like it if you could even go a little bit further and say how you could avoid that error from happening to begin with. Please make sure that your initial discussion post is up on Tuesday night. Your written assignment for this week, yes, I know it's week 11, you shouldn't have one, but you do, and I apologize, So your written assignment this week is looking at that federal law for safety equipment, HIPAA, and professionalism in regards to phlebotomy. Okay, so you're going to take those 3 items and look at the positives and the negatives of each. But you're going to look at the positive and negatives of those 3 items as they apply to the phlebotomy procedure, those 3 items, positives and negatives, as they apply to you as a medical assistant, and the positive and negatives of all 3 of those as they apply to the patient. Okay, this should be about 2 to 3 pages in length, and it should be in proper APA format. Alright, and then the last thing that I have for you guys is you will have your final exam this week, and that will be online. And just like I talked about last week in class, we will do a quiz review, or final exam review, before you actually get to take your final. So if you want to be ballsy and just take it beforehand, go ahead. I'm not going to say no to it, okay? You'll notice I have not said anything about due dates on here. And I normally do that, but this week, because it is finals week, everything will be due Friday at midnight, okay? Courses will close Friday, so you won't be able to turn in any more work, and if you do, I will not accept it after Friday at midnight. So please make sure that you plan accordingly so that way you have all of your work in and on time. Alright, ladies, and that is all I have for you this week. Happy finals week, and I will see you on Wednesday. Bye!